Hello and welcome to my YouTube channel, Professional Lectures. I hope you all audience, you all viewers will watching my videos, will enjoy my videos. My videos are very helpful because I'm discussing different types of lectures based on pathology and a very good explanation. So in the previous lecture videos I had already discussed the pathology introduction, the etiology of pathology, core of pathology, also discuss different topics of pathology, like I discussed cellular injury, cellular adaptation, I discussed necrosis, calcification, pigmentation, gangrene. But now in today's topic I will discuss the inflammation, types of inflammation like acute inflammation and chronic inflammation. So let start my topic. But before I am going toward to start my topic, I first kindly request you to subscribe my YouTube channel Professional Lectures and like my video. And if you have any question related to the video or related to the topic, then you can ask me in the comment section. I will be very grateful to give you answer of your question. So basically, inflammation is the reaction of living tissue to all forms of injury. The clinical significance, it is a protective response. Inflammation is a protective response. It tends to destroy the invading microorganism. It tries to inactivate the toxins. It helps in healing and repair. It helps in clearing infections. It may be potentially harmful in some conditions, for example, viral encephalitis like brain inflammation. Types of inflammation, there are two types of inflammation: acute inflammation and chronic inflammation. Acute inflammation, it is the immediate and early response of the body to injury. The characteristic of acute inflammation is relatively it have short duration, lasting from a few minutes up to a few days. Formation of inflammatory exudates, predominantly neutrophil leukocyte collection. Extravascular fluid, exudate is basically extravascular fluid with high protein content that leaks from blood vessels. Changes in acute inflammation, there are of the following changes like vascular changes and cellular changes. So in today's lecture video we will discuss the vascular events, and in the next lecture we will discuss the cellular events. So vascular events, vascular changes is basically vascular changes or changes in the caliber of the blood vessels like vasoconstriction and persistent vasodilation. Vasoconstriction, initially there is vasoconstriction in the small blood vessel that is transient in nature in response to acute injury. Persistent vasodilation, the initial vasoconstriction is rapidly followed by persistent vasodilation which persists for the duration of the inflammation. Another vascular changes is change in the blood flow, changes in the blood flow. The first change in acute inflammation is an increase in the blood velocity due to dilatation of the terminal arteriole. The pace is short-lived and soon followed by the slowing of the blood stream, which is called stasis. Changes in vascular permeability in acute inflammation, there is an immediate marked increase in the permeability of the capillaries and venules due to active contraction of actin filaments in the endothelial cell. There are 5 possible mechanisms of increased vascular endothelial permeability, like endothelial contraction, endothelial cell retraction, direct endothelial cell injury, leukocyte mediated endothelial injury, leakage from regeneration capillaries. Patterns of increased vascular permeability, there are 3 patterns of increased vascular permeability depending upon the severity of injury: immediate transient response, delayed transient response, and immediate prolonged response. So immediate transient response is, it occurs in mild injury. It begins in 1 to 2 minutes after the injury and persists for 15 to 30 minutes. It is due to endothelial cell contraction mediated by histamine bradykinin release. Delayed prolonged response, it occurs in moderate injury. It begins 30 minutes to 10 hours after the injury and persists for 4 to 12 hours. It is due to direct injury to the endothelial cell. immediate prolonged response. It occurs in severe injury. It begins soon after injury and persists for 1 to several days. It is due to endothelial cell necrosis. While exudate is extravascular inflammatory fluid with high protein content and much cellular debris that leaks from the blood vessel into the interstitial space due to increased vascular permeability. Mechanism are normally capillaries and venules are freely permeable to water and electrolytes, but not to protein and other large molecule. Rapid exchange take place between intravascular and extravascular spaces. There are 3 factors that regulated this transport. Capillary hydrostatic pressure, it occurs, it causes escape of fluid out of the vessel. Osmotic pressure of protein in interstitial space, it pulls the fluid from vessel to interstitial space. Plasma oncotic pressure, it holds the fluid into the vessel. During inflammation, there is exudation of fluid because of increased permeability, hydrostatic pressure, and increased vascular permeability. Effects of exudation, it causes dilution of the irritant and redness. Its effect, it acts as a chemical mediator for various activities of inflammation. Formation of lactic acid by white blood cell in the inflamed area reduces the pH that inhibits the growth of bacteria. It carries immune defensive substances to the affected area like antibiotics. Fibrin in the exudates fibrin in the exudate acts as a barrier. Fibrin in the exudate acts as a barrier against the spread of infection. Fibrin also helps in the repair. While transudate is the ultrafiltrate of blood. It has low protein content. It is because of increased vascular hydrostatic pressure. Permeability of the endothelium is normal in transudation. Examples are renal failure and cardiac failure. So this is all about today video. So in this video we had discussed the inflammation, acute inflammation and their vascular changes. In the next video we will discuss the cellular events of the acute inflammation, plus I will discuss the chemical mediators and the next lecture video. If my video is helpful for you and you understand my video, then I kindly request you to like my video and subscribe to my YouTube channel, Professional Lectures. Thank you so much for watching my lecture video. Take care of yourself. Goodbye.